All right, guys. So welcome to tonight's mastermind. So we're going to continue what we were doing from not last week, obviously, because we missed you then, but the week before, where we were going through kind of your intro to anatomy. So we're looking through an intro to lower body anatomy this evening. If you are just kind of tuning into the anatomy seminars that we do, it's not just teaching you anatomy for the sake of it. We're kind of running through stuff that is relevant to your training, stuff that you do within your training exercises that use all of these muscle groups. We're kind of teaching you where these muscle groups are, what they do, all these sorts of things. So I've kind of condensed it down to stuff that is applicable and relevant and useful to you guys. So it helps you figure out what exercises train certain muscle groups or how to train certain muscle groups and how to figure out your own way of doing the exercises, all these sorts of things. Cool. Any questions, guys, before we get started?
Mm-mm.
Oh, great stuff. So we go through lots of info in these seminars. Please don't stress if it feels like it's too much. If you know something at the end of tonight that you didn't know at the start, that means I'm doing my job. Okay, so that's all we need is just to learn one or two things, and we repeat these loads and loads of times, so you won't miss anything if you don't absorb it all first time, which you just absolutely won't. You won't miss it. It will come round again, so don't stress about that at all. Okay, now I'll ask questions. We'll keep it quite interactive as we go through, but don't feel like you're on the spot if you don't feel like answering, or if you just want to kind of sit back and listen. That is absolutely fine. You're never on the spot in any of these seminars. Cool. Right, I will share my screen. Okay, so we're looking at lower limb and core anatomy. Can everybody see that on their screens at the minute?
Yes.
Yeah, fantastic. So lower limb specifically this evening. So we'll go ahead and look into core in a little bit more depth soon, but lower limb this evening. Okay, so these are the joints that we're going to be paying the most attention to start off with. So we're looking at the hip and at the knee. And we'll start off with the hip. Okay, what sort of joint is your hip?
Ball and socket.
Ball and socket. Yep. What else is a ball and socket?
Shoulder.
Shoulder, absolutely, yeah. Can you tell me some movements, if you remember them, at the shoulder joint that we've got available?
Abduction.
Abduction, yeah.
Abduction.
Rotation.
Some rotation, yeah. So two types of rotation.
Isn't it flexion and something?
Flexion. Absolutely, yes.
Oh, vertical flexion, vertical extension.
Absolutely, yes. So flexion and extension we'll go with, yeah.
Mm-hmm.
So we mentioned rotation. So we've got external and internal rotation.
Rotations.
Yeah, perfect, guys. Yeah, really good. So lots of similarities there. So you guys were mentioning your kind of vertical and horizontal flexion, which is perfect. Absolutely, that's available at the shoulder. That's not really something that is, it technically can be kind of available at the hip, but it doesn't tend to be kind of chatted about much like that. So at your hip, we've got all of the same movements available as you've got at your shoulder in terms of your flexion, extension, internal rotation, external rotation, abduction, and adduction. Okay, so we've got all the same stuff available. And we'll have a look at all of those movements, all of the muscles that are responsible for those movements, and go from there. Okay, so hip joint is a joint between which bones?
Excuse me.
Femur and, is it femur and pelvis or something?
Exactly, femur and pelvis. Yep, perfect. So this is your femur. This bit's called kind of neck of femur here. Okay, really common place to get fractures, unfortunately, especially in the elderly. You can get a neck of femur fracture. So that's neck of femur there, and that is the kind of ball at the head of the femur that slots into the acetabulum, which is the socket. Okay, that kind of big white bit there is like a suction cup, essentially called your labrum, that it kind of socks into that. Okay, so thigh bone attaching into your pelvis, that is your hip. Okay, knee joint, we'll come back to. Let's have a look at hips to start off with. Okay, so abduction of your hips. I'll stand up just so I can show you. Okay, so abduction would be lifting the hips out to the side.
Yeah.
Okay, which means adduction is bringing them back in again. Okay, we've got flexion, bringing them up in front of you, and extension, which is bringing them behind you. Okay, that's those movements, nice and easy. Right, I'm going to sit on the plane with my leg crossed up, and you can tell me what sort of rotation I've just done. Okay, so I'm going to cross my leg up. What have I just done?
Horizontal.
It's turned so my shin is horizontal, but what has my hip done?
Internal rotation.
Okay, so you're thinking internal. Do we all
And
agree internal, or does somebody think
done some abduction as well.
a little bit of abduction gone on? Yeah, absolutely. So what are we thinking? Internal rotation or external rotation? There's definitely rotation. Everyone would agree that is a rotational movement of the hip there, yeah? Okay.
It's
Internal.
I thought it was internal, but it might be external because it's pushing out as you pull in, as you pull your knee across.
Exactly, yeah. So my hip joint, okay, so if you think about my femur, as I do that, it rotates out to get my knee up, doesn't it? Yeah. So that is external rotation. So external rotation, internal rotation. Okay. Perfect. Oh, I've got somebody coming into the room just there. 2 wee seconds, guys. Cool. So these are all your kind of movements that are available at your hips. Now, rotation movements, I don't want you to worry about too much because we typically don't tend to isolate them in training because all of the muscles that are responsible for rotational movements and rotational movements themselves tend to naturally happen with a lot of movements that you end up doing in training. So if you think about squats, kind of positioning your legs out, all these sorts of things, there's all sorts of kind of different planes of movement that we're actually going through whenever we're doing these movements. Even as you're walking, okay, if you imagine you step forwards, okay, so your pelvis is going to turn like this, but your foot still points forwards. Okay, so if your foot is here and your pelvis is in between, we can see how that they have to rotate a little bit. Otherwise, as you walked, it would go like that the whole time. Okay, so you have to have rotation for that to be happening. So rotation tends to happen quite naturally a lot of the time during a lot of these movements. We don't always just kind of isolate it. Sometimes for rehabilitation purposes we may do, but most of the time we don't bother. We tend to do more functional movements because we get a lot of engagement of rotational muscles during kind of normal functional movements. So we are looking at this person here from the front, from the back, from the side. What do we think?
Front, I want to say.
From
Yeah.
the front. Are we all in agreement? We're looking at the front?
Yes.
Yeah.
Yeah, you're absolutely right. Yeah, we're looking at the front. Okay. How can we tell that we're looking at the front?
The shape of your pelvis is curved to the back.
Shape of the pelvis, absolutely.
And you've got your leg, your top of your femur is forward. Sits at the front.
Yep.
Presumably these are muscles which go across the joint in front of the joint.
These are muscles that go across the front of the joint. That's absolutely correct. Another reason we can tell that we're looking at this person from the front is that we can't see spinous processes. Yeah. So spinous processes are the knobbly bits of your spine. So you can see if somebody kind of sits hunched like that with their top off, you can kind of see the little knobbly bits up the spine. So we'd be looking at, can't really see them. I'm gonna have to go a long way here. There we go. So we can kind of see these knobbly bits of the spine just here. Okay.
Yeah.
We can't see that there. Okay, we can just see the intervertebral discs. Okay, these are discs, which I'm sure you've all heard of. Okay, so we're looking at this person from the front. Okay, now these cross over the front of your hips, for sure. We can kind of see that. So if a muscle crosses over a joint, we know that it definitely is going to move that joint. Okay, because it's reaching and grabbing the bone on the other side of the joint. Okay, so we know it's going to be able to move the joint. Now it crosses over the front of the joint. So if something goes over the front of the joint, which direction does it move the joint?
Forward, flexion.
Forward, absolutely. So in this case, or in the case of your hip, what is forward movement of the hip?
Flexion.
Flexion, absolutely. Yeah, I'm glad you said it. I was going to lose balance soon. There we go. So flexion is forwards movement of the hip. Okay. So we can tell by looking at this muscle. Can anybody name it, by the way?
Yeah.
Ah, cool. So I think that's kind of cool. You can look at a muscle. Oh, say again.
It's not that scapula arteria one, is it? No, because that's
No,
round the
not
back.
quite. No, we're looking much kind of lower down there. Yeah.
No.
But I see what you mean. It's a similar sort of shape there.
Yeah.
So I think that's kind of cool that we can look at a muscle and we can reason based on its position. We can reason what it does without knowing what it is. Okay, and you may not know that that muscle even existed before me showing you a picture of it just now. Okay,
No.
so that's quite cool, right? If you can see a diagram of a muscle and figure out what it does by looking at it, I think that's a really useful thing. Okay, what did we say about muscle fibers? Anybody remember that?
The direction that they move, the direction that they lay in.
Exactly, yeah. So we can look at direction of the fiber. So if everybody looks at the screen right now, we can see the kind of grain of the muscle. Okay, so that is how muscle is structured. Again, if you look at meat, that's how you can see, because meat is muscle basically, right? So whenever we have a slice of meat, if you look at it, you'll be able to see there's a very clear grain in the meat. Okay, we're seeing the same thing. We're seeing fibers. Okay, when a muscle contracts, it gets shorter. Okay, so it pulls together on the fibers like interlocking fingers. It's called a sliding filament theory. So when we see the direction of the muscle fibers, that also gives us a clue as to what the muscle does. So which direction do we see the fibers going in here mostly?
Vertical. So they will go up.
Yeah, up and down, yeah. So they're
Yeah,
mostly
up
kind
and
of
down ones.
up and down that direction. You've got a little bit of kind of curve, but they're
Vertical.
mostly kind of up and down. Okay, which means, yeah, we've got that movement, so upward movement. Make sense?
Yes.
Cool. So we can kind of tell by looking at it, but it's unlikely that it does any of this stuff.
Right. Okay. Yeah.
Just based on where it's attached and the direction of the muscle fibers. Okay. So we're looking at something called your iliopsoas, which you may have heard of before, you may not have. So this portion here is your iliacus. Okay, and this portion up here is your psoas. Okay, these are sometimes just called hip flexors.
Oh, yeah.
For obvious reasons, yeah. So hip flexor muscles we're looking at there. Right, apart from the obvious, what are we looking at there?
Gluteus maximus or something.
Gluteus maximus, absolutely, yeah. So biggest muscle of your bum, essentially, gluteus maximus. Okay. Now tell me what you can see with regards to positioning of the muscle, various different factors that you can kind of see on the screen there that can give you some clues.
Goes in various directions.
Various directions, absolutely.
Yeah.
Quite horizontal though, would say, yeah.
Yes. Yeah,
Absolutely,
quite horizontal.
And where is it positioned? Front, back, side?
Back.
Back, absolutely, yeah. So it's positioned at the back. So stuff at the front flexes. Is that stuff at the front does flexion? What's the opposite of flexion?
Extension.
Retraction.
Extension, absolutely. So opposite of flexion is extension. Okay, so we've got glutes at the back in the opposite place, covering the opposite side of your hips. So we can kind of reason from there that glutes are going to do extension. Okay, just because of their position. But as you rightly pointed out, we've got some kind of horizontal fibers there. Okay, now what sort of movement do you think that could generate? If we look at their position, look at the bits they're kind of attached to.
Horizontal.
Definitely a kind of more
Your legs
horizontal type
come
move.
out sideways.
Oh
no, rotating.
Rotating, absolutely, yes. Yeah. So
Rotating.
just where they're attached, they're not really on the side enough to be able to pull us outwards to the side. They're more on the back, so we kind of know that's not going to happen. But they do rotate. They do rotate your hips. So, if everyone stand up for me if you can. Okay, don't worry if you don't have space or you don't want to. Okay, now if you, as you're stood there, if you squeeze your bum cheeks together, basically. So squeeze your glutes nice and
Yeah.
tight. And then if you just kind of like shift your weight from side to side like that and just let your feet arrange themselves as your feet feel most comfortable with your glutes really tight, okay? Now, if you all look down at your feet, okay, I can't see them, but I'm hazarding a guess that they're pointing outwards right now.
Yeah, they are. Yeah.
Yeah, cool. So what movement is that? An outward rotation.
That's yes, an
Pronation.
outward rotation.
External rotation, absolutely, yeah. So glutes are responsible for external rotation, and we can see that kind of quite clearly when we do that, right? So you can stand with your feet straight and squeeze your bum, and you'll actually feel the feet wanting to do that. So as soon as you take them off the floor, they'll just go bop, bop, like that, and they'll point outwards. Okay.
Oh, yes,
That
you're
makes
right.
sense.
Yeah.
Yeah, feet going straight out. Yeah, perfect. Cool. So hip extension, when do we extend our hips against resistance? When do we straighten out our hips against resistance?
Don't know, squats.
Absolutely, yeah. We straighten your hips against resistance, don't we? So if I'm doing a squat, okay, if I'm sideways on here, what am I having to do to stand up? I'm having to straighten my hip out against resistance for my squat, aren't I? Yeah. Okay, so we know that glutes are going to be responsible for that. Is there much force? See if I'm here in a squat, moving from here to here, okay, is there much force trying to stop me from straightening my hips out? From here to here?
No.
Not much at all, right? Because gravity is pulling downwards, okay, and I'm just having to get my hips forward. So there's not much force. However, if I'm down here, now is there a bit more force?
Yeah.
Yes, you've got to work harder.
Absolutely, because gravity is pushing me downwards. So now gravity is more actively trying to bend my hips. So I have to work my glutes harder in order to extend them, which means that your glutes work harder at the bottom of a squat
Okay.
than at the top. Okay. Cool. Hip thrusts. We've done those before. Glute bridges.
Yes.
Yeah. What we're doing there, straightening your hips out against resistance. Yeah.
Yeah.
So hence why it's a glute bridge. Okay. Now, what are we looking at there?
Hamstring.
Now we're looking at this person from the front or the back?
Front.
Front. Quads.
Quads. Yeah, absolutely. Yeah. So it's the right area for the hamstrings. We're looking at this person from the front. So we know it's the muscle at the front, which is the quadriceps. Now, they definitely do stuff at the knee. We're not talking about knees just yet, though. We're just talking about hips. Okay. Now, you can't really see here, but part of your quadriceps, not all of them, but part of them actually do cross over the front of your hips. Okay. So if a muscle crosses over the front of the hips, what do we think it does?
Pulls it forward. Flexion.
Forward, which is flexion, Lynn. Yeah, spot on. Well done. So quadriceps, or part of them, are responsible for flexion of your hips. Now, if I were to ask you to stretch your quads, how would most of you do that?
Leg
Grab
extension.
my ankle from behind.
Okay, cool. Let's do that. Okay, so if I grab my ankle from behind, okay, am I stretching my quad?
You know, to put it all the way behind. So
Okay,
your knee
absolutely.
pointing
Okay,
downwards.
so I'm stretching my quad, so you're absolutely right. I'm stretching it here because my knee is completely bent, okay? But you're suggesting that I do that to get a better stretch, right?
Yeah.
Okay, so you're absolutely correct. That would be a better stretch for a part of my quad. What have I moved when I did that?
Your hip.
My hip, absolutely. So I've moved my hip to do that. So you already knew that your quads had an effect on your hips because you know that in order to stretch my quads, I have to do something with my hips. Okay, that wouldn't be necessary at all if they didn't cross your hips. It's like saying, you know, is moving my shoulder going to help me stretch my quads more? Definitely not, because my quads don't cross over my shoulder. Okay, so we would only have to move your hips if we knew already that your quads actually cross over, and moving your hips would have any sort of effect on that whatsoever. So to stretch a muscle, we do the opposite of its function, don't we? We just try and, so when a muscle contracts, it gets shorter. So to stretch it, we want to kind of make it longer. So we're just doing the opposite of what its function is. So we know that quads they do something at your knee, which we'll talk about later, but quads are doing hip flexion. So to stretch them, you've told me to do the opposite, which is extend my hip. Okay, so
Okay.
exactly right there. Does that make sense?
Yeah.
Yeah, perfect. Cool. And I didn't fall over while I was on one leg, so that's always a bonus. What are we looking at here, guys?
No, it's hamstrings.
Now it's
Yeah,
hamstrings, absolutely. Yeah, yeah, now it's hamstrings. Cool. Now we can see a few different kind of muscles there. Casey, hamstrings kind of made up of 3 main muscle groups. Okay, now they cross over the back of the knee. We can kind of quite clearly see that. So we know they do something at the knee, but we're still just looking at the hips. You can't quite see it, but I'll let you know they do cross over the back of your hips. What does stuff that crosses the back of your hips do to your hips?
extension.
Extension, absolutely. So
Yeah.
hamstrings, very strong hip extensors. Okay, really strong hip extensors. Now a few different kind of muscle groups there. We've got the same in quadriceps. We've got a few. Guess how many muscle groups make up your quadriceps?
Oh,
4. Yeah,
Four.
absolutely. Yeah, yeah, 4. Biceps,
2,
2. Triceps,
3.
3.
yeah. So some names follow a nice little pattern like that. So for those of you, by the way, that were curious, quadricep wise, the bit that crosses over your hips is called your rectus femoris, and it's that bit in the middle that crosses your knee and your hip. Okay, everything else is called vastus something or other. Okay, so we've got vastus lateralis, vastus medialis, and vastus intermedius, which we can't really see. None of that stuff crosses your hip. So technically what I was doing before, when I stretched, I'm stretching all of my vasti muscles here, but now I'm getting rec fem as well. Okay, so a few different muscle groups there, a few different ones in your hamstrings. So we can see that they're all kind of starting out from pretty much the same spot, and they're crossing over the back of the knee. They're going right down the back of the thigh. Now they attach onto your sitting bones. Okay, so the kind of bony bit of your bum that you're all sat on now. Your hamstrings attach onto that. Okay, that is called your ischial tuberosity. We can see it right here. Okay, so hamstrings are attached onto that, and you can kind of imagine. Okay, well, what exercise do you do where you feel a stretch in your hamstrings?
Bending over.
You lean forward, yeah.
Bending
Forwards,
over,
yeah.
absolutely. So anybody doing RDLs at the minute? This exercise?
No.
Yes.
Somebody? Yeah, cool. Romanian deadlifts, they're called sometimes. Yeah, RDLs,
Yeah.
cool.
Yeah.
So if we imagine hamstrings are attached onto the bony bit of the bum here and they come down. Okay, if you imagine if there is, so we kind of come past the hip joint here with your pelvis. So you can imagine something attaching onto that part of you, pulling downwards. You can see how that would straighten you up. Okay, if we pull the back of the hips down like that, that straightens you up. That's what hamstrings do. Okay, so when they're stretched in that position, they work really hard to straighten you up. So for that bottom bit of the movement, hamstrings are working really hard. Okay, that makes sense?
Yeah.
Yeah, cool. Can you guess a sport that we see the most hamstring tears in?
Weightlifting.
Not weightlifting.
Rugby.
Athletics.
Rugby's getting closer.
Football.
Football, yeah, absolutely. Yeah.
Is it?
What are you doing when you play football, right? You're going with maximum force.
Change direction.
Yeah, so big stretch through the hamstring. Yep. Yeah, so football we get a lot. Weightlifting or lifting weights is one of the lowest rated injury sports out there. In fact, jogging, especially in novices doing couch to 5K, you're approximately 10 times more likely to injure yourself than you are lifting weights. If you do lift weights regularly, you're less likely to injure yourself doing any of that other stuff as well. So don't worry too much about lifting weights. It's got a really bad rap, and people associate it with injuries. But you are, as a result of lifting weights and getting stronger, less likely to injure yourself in the long run. And other sports have a much higher injury demand or injury prevalence. Sorry, I should say. Cool, makes sense.
Yeah.
Yeah, cool. So muscles at the front move the hips forwards. Muscles at the back move the hips backwards. We've kind of discovered that
Yeah.
so far, right? So these muscles are on the side of the hip. So what do they do to the hip?
Move it sideways.
Sideways, absolutely. These muscles are on the outside of the hip. So what sort of sideways do they move it in?
Abduction.
Abduction. Yeah, perfect.
Mm.
Yeah. So your leg's getting taken away. Okay. Abducted. Getting abducted by aliens. It's getting taken away. Yeah. So abduction. Okay. Now we're looking at this person from the side here. So we're looking at glute med and glute min, or glute medius and glute minimus. Okay. So these muscles attach. And for those of you that want to try it, you can stand up. Okay. So they attach between your iliac crest. Okay. So that is the top of the pelvis just here. You can all probably feel that if you kind of dig in. That's the top of the pelvis. Okay. And then if we walk the fingers down and feel right about here, okay, you'll feel your side of your hip bone, okay, which is that bit at the bottom, just there, if you see my cursor, okay? And you can see that the muscle travels between those 2 points. Okay, so hip bone, imagine if you were to fall on your side, your hip bone is that bit that would be sore, the bit that would hit the ground first, okay? So those 2 points, that's where glute med and min sit. So I want you to dig your fingers in right in between those 2 points, or dig your thumbs in, okay? And just march on the spot for me. And you're going to feel, as you're marching on the spot, that the leg that is on the floor is getting a bit of contraction through that side. So give that a shot for me, guys. March on the spot. Yeah. And can you feel it on that side that's working, or that side that's balancing? Yeah, perfect. Okay. So that's kind of weird, right? Because we said they do abduction, but when you march on the spot, you're not doing abduction, right?
Yeah.
So why are they contracting?
Because they're stabilizing you and stopping you from falling over. Or
They
something like that.
absolutely are. Absolutely, yeah, they definitely are. Cool. So to break it down even more, if I hold my cup of tea, if I'm holding it here in one place, is my bicep working right now?
It's
No,
holding your arm up, so I'd say yes.
Yes, it is, absolutely. Yeah.
Yeah.
If it wasn't working right now, I'm going to make a mess, right? I'm going to drop that tea. So biceps working just to hold it. Even though no flexion's going on, the bicep works just to hold it. Okay. What is gravity trying to do to my arm?
push it
Pull
down.
it down.
Extend it. Okay. So
Yeah.
bicep is an elbow flexor, therefore it prevents elbow
Extension.
extension. Absolutely. So muscles prevent opposite movements. Now, when I'm marching on the spot, I'll angle that down a little bit. So when I'm marching on the spot, if I stand on one leg, gravity wants to do that with my hips. Sorry, that's Jeppy coming back in. 2 wee seconds, guys, sorry. So when I'm marching on the spot, gravity wants to do that to my hips, okay? It wants to push my hips out to the side. Can you see how the leg that's on the floor now, when my hips are out to one side, can you see how it's adducted? It's in.
Yeah.
Yeah. So as I'm walking, okay, gravity wants me to walk like I'm salsa dancing all the time, okay? So to keep my hips in the middle, my glute med and min, my hip abductors are preventing adduction all the time as I'm walking. And that's why when you march like that, you feel them. Even though their function, which is hip abduction, isn't actually happening, they're just preventing adduction. So they're preventing that from happening as you're walking. Does that make sense?
Yeah.
Yeah. So you can train them very effectively by doing resisted hip abduction, but any single leg movement, they will be preventing the opposite. They'll be preventing adduction. So any lunges, Bulgarian split squats, single leg deadlifts, lateral hip musculature gets lots of attention whenever we're doing that. Cool. So whereabouts is this muscle positioned in relation to the hip joint? We're looking at this person from the front. We're looking at their right leg. Outside, inside, front or back?
To the
inside.
Inside. Yeah, absolutely. Inside and maybe a little bit to the back. Would you agree?
Yeah.
yeah.
So muscles at the back do extension, muscles at the front do flexion, muscles on the outside do abduction. So muscles on the inside do
Extension.
Adduction.
adduction. Absolutely.
Yeah.
Adduction, yeah. And it's a little bit at the back as well. So they also do
Extension.
extension, yeah. So we can look at a position of a muscle and figure out what it does without knowing the name of that muscle. Anybody know the name of the muscle? No. Perfect. So that's quite a nice way to figure stuff out at the hip. Just look at where it is, okay, and we can figure out what it does. Okay. Now, if you were to stretch that muscle, what would you do?
Sit down.
Kind of, yeah, kind of.
Stretch it. Stretch it.
How do you stretch the inside of your thighs?
Open your legs.
Open your legs, absolutely, yeah.
Yeah.
Okay, so a muscle that adducts, that brings them in, how do you stretch it? Just bring them out. Simple as that, yeah. How do you stretch it even more? Okay, you would sit with your legs out and you would bend over forwards. Okay, so how do we stretch a muscle that does adduction and extension? We do abduction and flexion. We stretch it out. Yeah, so same idea as what we were saying before for those other muscle groups there in the quads. Okay, so this one is quite nicely named. It's called your adductor. Okay, which is quite nice. It's a nice one to remember because it does adduction. Now, there's kind of three parts. So you've got magnus, longus, brevis. Magnus is a bit that attaches onto, what are your sitting bones called? Does anybody remember?
Oh no, can't remember that. I can't remember what it was.
Ischial tuberosity, it's called. Don't worry about that one. Yeah, but sitting bones will do. So adductor magnus sits onto that one. And for a reason that we'll discuss soon, your adductors work way harder than your hamstrings do whenever you're squatting. Okay, so if you're to do a squat or a sit to stand, so if I'm to sit here and stand up out my seat, my adductors have just worked way harder than my hamstrings for extending my hips there. So glutes and adductors work much harder than hamstrings do when you're squatting. Okay. Everybody make sense of that? Any questions? No, fantastic. Good. So that's hips in a nutshell. There are other muscles that cross over them, but we don't need to worry about those too much. Now, knees do flexion and extension. So flexion means bending, extension means straightening. Now, we're going to have to be a little bit careful when we go through here because previously everything at the front did flexion, whereas now flexion is going backwards almost with the knee. It's a little bit the other way around, okay? Because we're not flamingos, okay? So flexion is going that way and extension is straightening out. Has anybody done leg extensions at the gym?
Yeah.
Yeah. Yes. What hurts when you do a leg extension?
Quads.
Quads, absolutely, yeah. So what do your quads do?
Stretch.
Extension.
Extend.
Yeah, absolutely. So leg extension hurts your quads, so your quads do leg extension or knee extension, yeah. So if we go back and have a look at the knee, we've got knee joint, which is basically between your femur, so that's the bottom end of your thigh bone, and your tibia, that's your shin bone, okay? Your patella is kind of like a floating bone, okay? So it sits in the middle of a big tendon, and we call the bit at the top your quad tendon, the bit at the bottom your patella tendon, okay? And your quadriceps come and attach onto the top of your kneecap there, okay? You don't need to worry about the kneecap being there. It does serve a very important purpose, but you don't need to worry about it too much. Just imagine it's not there when we're figuring out what the different muscles do, essentially, okay? So your quadriceps, sorry, 2 seconds. There you go. Quadriceps come and cross over the front of your knee via your patella. Okay, so imagine that was also colored in red and this bit was colored in red and it attaches onto, can everybody find the bony bit at the top of your shin? Okay, so
Yeah.
that bit is called your tibial tuberosity. Okay, so that bony prominence at the top of the shin there. Quadriceps reach over the knee joint and attach onto that, which is how they're able to extend your knee. If you all put your hand on your thigh and straighten your knee out, you'll feel your quadriceps doing a little something. Everyone agree?
Yes.
Yeah,
Yeah.
perfect. Cool. So quadriceps cross over the knee, so we know they're strong knee extensors. Okay, so they're hip flexors and knee extensors, which means to stretch them, as you guys told me to do before, we just have to do the opposite. Okay, so we do knee flexion and hip extension, and now we've got a quad stretch. So that's why you stretch your quads like that when you stretch them. Okay. Any questions there? That makes sense.
Yeah.
Okay.
Yeah.
What other exercises are we doing where we have to straighten our knees against resistance?
When you're rowing.
Rowing, yep, absolutely. Are you thinking of like cardio rowing?
Yeah.
Yep, so on a rowing machine, absolutely. So we're kind of coming forwards, bending the knees, and then we're having to straighten them out against resistance. So quads will definitely be working there.
Mm-hmm.
Anything else?
That's not planks, is it?
Not too much, no. I mean, they'll probably be active, but they won't have to work too hard. You wouldn't fail a plank because of quad strength, I wouldn't have thought. But they're probably active.
No, I was on this machine yesterday where I was lying down and had to push my feet up.
Leg
Brilliant.
press.
Yep. So you're on a leg press. Sounds like a kind of vertical leg press, was it? Did you feel like kind of
lying down and you push your feet up?
were you pushing vertically up or 45 degrees up?
It must have been about it wasn't definitely vertical, more 45 degrees up.
45. Cool. Yeah. So you're on a 45-degree leg press. So yeah, your quads work really hard on a leg press. Absolutely. Yeah. Squats, lunges, all these things we're having to, when we stand up, straightening our knees against resistance, aren't we? So quads work pretty hard on those. Okay, hamstrings. Okay, so quads cross over the front of the knee and do extension. Hamstrings cross over the back of the knee, therefore they do what?
Extension. Extension.
Quads cross over the front and do extension. So hamstrings cross over the back and do flexion. Absolutely. So it's the other way around. So if something goes over the front, it's not always flexion. If something goes over the front, it moves it forwards. That is always true. But in this case, moving it forwards is extension of the knee. Moving it backwards is flexion of the knee.
Yeah.
Because your knees bend in the opposite direction to your hips do, like that.
Yeah.
Cool. So hamstrings do knee flexion. Can you think of any exercise where you're having to bend your knees against resistance?
Resistance.
Knees.
Are you thinking about deadlifts or anything?
So deadlifts, we are more straightening our knees against resistance because we're standing up with a deadlift. So that will be a little bit more kind of quads there. But you're absolutely right that you do use hamstrings in deadlifts, but it's more of a hip extension function.
It's what are those?
The squats.
So squats, again, we are, now your hamstrings will be active, but more because of the hips. But squats, again, what am I doing in a squat? I'm straightening my knees against resistance. So actually, when I bend my knees in a squat, okay, when I'm squatting down, gravity is helping me do that, right? So gravity helped me do that squat just now, okay?
The only one I know is the hamstring bridge. That's
Hamstring bridge is a good one. Yeah, absolutely. So a hamstring bridge, you are trying to kind of bend the knees against a bit of resistance, also trying to extend the hips, so a bit of both. Has anybody done a hamstring curl at the gym?
No.
yeah.
Yep,
No.
yep, absolutely. Hamstring curl is just a machine where you just bend your knees against resistance. You may have also done like a kind of standing hamstring curl, so a little bit of weight on the ankle, and we're just bending the leg up behind you. Okay, so that hamstrings as well. Okay, cool. Interesting one. we said before, if you point your feet out, that's external hip rotation. If you point your feet in, it's internal hip rotation. Can everybody, as they're sitting, pop your hands like that, okay, and pop your fists in between your knees and squeeze them together. Okay, now keep the hands squeezed, and I want you to point your feet outwards. Okay, have you managed that? Yeah. So
Yeah.
right now, did you feel your hips move at all when you pointed your feet out?
No.
No.
My
Okay,
knees.
so the feet just pointed out, but the hips didn't do it. Okay, now if you straighten your legs out in front of you, straighten your knees, now point the feet out.
Yeah, then your hips move.
Now we felt the hips move. Okay, so knees are kind of weird in that when they're bent, your knee can rotate. When it's straight, it can't. It's called the screw home mechanism. Okay. And your hamstrings have a little impact on the knees. So if you actually feel the back of one knee, so I want you to get your hands in underneath the back of the knee. And now I want you to point your foot from side to side in that position. Okay. Can you feel some bands in the back of your knee getting a bit taut as you do that?
Yeah.
Yes.
Yeah. Okay.
Yeah.
So what you're feeling is what you see on the screen there. So on the inside, we've got semitendinosus, semimembranosus. On the outside, we've got bicep femoris. Okay, so these are your hamstring muscles that come down and cross over the back of the knee there, and they have a little rotational effect on the knee as well in different positions. Cool. All that makes sense, guys?
Yeah.
Yeah, fantastic. So I will nip nice and quickly through ankle stuff. We don't need to pay as much attention to that, but we'll go through it just quickly. So we've got dorsiflexion, plantarflexion, inversion, and eversion. Okay. Dorsiflexion, plantarflexion. You remember plantarflexion because, sorry, I'll sweep back even further. You are planting your toe. Okay, dorsiflexion,
Okay.
you are bending your toe upwards. Okay, now I'm hypermobile, which means my ankles are weirdly bendy, so it's nice and easy for me to kind of demonstrate this, but most people's ankles won't really bend that far. Okay, now inversion and eversion are your kind of movements where we're moving in and out like this. So it's a kind of rolling your ankle movement, so that's inversion, and eversion is an outward roll of the ankle. Okay,
Yeah.
does that make sense?
Yeah.
Cool.
Yeah.
I had to scoot quite far away from the camera to do that, so could you all hear me okay?
Yeah.
Yes,
Yeah.
we could. Yeah.
Perfect. Okay. So these are your main ankle movements. When are you doing plantarflexion?
When you walk. Yeah.
When you walk, absolutely. Yeah.
Yeah.
Which leg is doing plantarflexion when you walk?
Which
leg?
Yeah, which leg or at which point as you walk is it doing plantarflexion?
The opposite to the other one, wasn't it?
Yeah, absolutely. Yeah. Yeah. How would you describe which leg is doing plantarflexion when you walk, and how could you describe it and always be right? Whether it was left or right leg, how could you describe it?
I don't know. It's
The one that's going forward first, pointing. You're pointing one.
So I'll show you here. Let's put this down. Can you all see my feet okay there?
Yeah.
Yeah. So as I walk, okay, here our foot is dorsiflexed. As I step down, okay, so we're looking at this foot right now. Ignore my other one, okay. So as I step down, okay, I'm having to control that motion, okay. So a muscle at the front of my shin that pulls my toe upwards that we'll look at shortly, having to control that motion, okay. Now I'm stepping through, and now at this point I'm doing plantarflexion to push off my toe. So the way to describe it would be it's your back leg that does plantarflexion, if that makes sense. So as you walk, okay, if you look, it's my back leg now doing plantarflexion, and then it's my fell over. It's my back leg on the other side also doing plantarflexion. Okay.
Yeah.
Okay.
that make sense?
It does now.
Yeah,
Yes,
cool.
yes.
It's a weird question, right? But it makes sense why we ask it. Okay. Cool. Great stuff. So inversion, eversion, a lot of the time, the muscles that kind of control those movements are just working as kind of stabilizers, because as you can imagine, as you're walking, we've constantly got lots of forces acting on you. Okay. If you get somebody to balance, not sure if you'll be able to see here, but if I were to balance on one leg, there we go. Now you'll see, I'll wiggle this leg around a little bit, and you can see the ankle kind of moving in order
Yeah.
to stabilize. Okay.
Mhm.
So it is kind of constantly firing inversion and eversion, these sorts of things, just to keep the ankle nice and stable. But we do have control over that movement as well to an extent, and you'll be using it in lateral movement. So if you're pushing from side to side for whatever reason, if you were needed to move in that direction, or if you were dancing or playing a sport or something along these lines, we'll definitely be using kind of inverters and everters quite a bit. Cool. So muscle at the back. Okay, we've got your calf muscle. Okay,
Yeah.
or gastrocnemius it's called. That is attached to your heel via what tendon?
Achilles.
Achilles tendon. Yeah, absolutely. Yeah, Achilles tendon. Okay, now another muscle shares that tendon, and that muscle is called your soleus. Okay, main difference between these two muscles, your calf goes across the back of your knee, your soleus doesn't. Okay, what other muscle goes across the back of your knee that we've just looked at recently?
Oh, jeepers.
The hamstring.
Hamstring, absolutely. The one on the screen just there. Yep. So hamstring also goes across the back of your knee. Hamstring bends your knee. So muscles that go across the back of the knee bend your knee. It's a nice way to remember it. So your calf bends your knee and it plantar flexes your ankle. Okay, so you can imagine it would pull your heel up. And if we pull your heel up, what are we doing? Plantar flexing. That makes sense?
Okay.
Yeah.
Yeah.
Great stuff. Cool. No worries at all, Amanda. All right, we'll see you next time. Cool. So calf is doing that at the knee. It bends the knee and plantar flexes the foot. Soleus doesn't bend the knee, but it does plantar flex the foot. Which means if we were to do heel raises from a bent knee position, we use your soleus. Okay, we take your calf completely out of it. But if we were to do calf raises or heel raises from a straight knee position, we use both of them at the same time. Make sense?
Yeah.
Now, there's a bunch of other muscles there. I don't want you to worry about those guys too much. We'll have a look at a couple of them in a few seconds, but I don't want you to stress about those too much. These are just kind of extra wee muscles in the kind of posterior compartment there of the shin, essentially, and they're involved in various different movements at the ankle. But calves are the main ones that you'll be feeling whenever you train that kind of movement.
Mm-hmm.
Okay. So muscle at the front of the shin we talked about. Okay. So what does that do? Just look at it. Tell me what it does by looking at it.
It'll move your foot because it
move your foot because it crosses
Yeah, it will
over
move
the
your
ankle
foot.
joint.
Absolutely, yeah. So it
does,
moves
isn't
the
it?
ankle joint because it crosses over it. So how does it move the ankle joint?
Will it pull it up?
Up.
It will pull it up, absolutely. And it pulls it up and a little bit in because you see it's on the inside there.
Yeah.
If it was right in the middle, it would just pull it straight up, but it's on the inside, so it pulls it up and in. So muscle at the front of your shin is called your tibialis anterior, right? Tibialis meaning shin and anterior meaning front. So nice and straightforward there. So because it pulls your toe up, that means it also controls the downward movement of your toe. So as you're stepping, as your toe is lowering, okay, it controls that movement. Okay, if you've ever had like a sore tibialis anterior, you'll be walking and slapping your toes as you walk. If that muscle is very tired for whatever reason, I'm not sure if any of you have ever experienced that. But very disconcerting. People can hear you very loudly whenever you walk, whenever you do that. So if you've had to like suddenly land from like a jump or a run or something like that, it'll get lots of force going through it essentially, and it can then get quite tired and that sort of thing. So you can get a little bit of foot drop sometimes temporarily from that, or if there's anything that's stopping that muscle from innervating, you get a kind of slapping foot as you're walking for that reason. Okay, now to name these other muscles briefly, we have got plantaris, which is this one, which some people don't even have, which is mental to me that some people just have muscles that others don't. It's involved mostly in kind of proprioception. You can see this big, long, weird looking tendon thing coming down here. Then the muscle just up at the top, that's the one that we can see just there. And we've got popliteus, which is involved with a little bit of knee flexion and specifically the kind of unlocking bit of the knee, and it does a bit of internal tibial rotation. And we've got that's just soleus, by the way, so that muscle there is this muscle here. And we've got your tibialis posterior here, so that does plantar flexion and inversion, and we've got perineal muscles on the outside, so they do eversion of the ankle. Okay, so that's plenty muscles for one day, I reckon. Okay, any questions, guys? Say again?
No, nothing. It's all right.
No worries. Any questions, guys?
No.
No.
No. Cool. Does that make sense and you have a better idea of some of the muscle groups that are involved in your training?
Yes, some of the muscle groups. Thank you.
Yeah, it does. Just
Yeah.
doesn't stay in. It's brain like a
It's
sieve,
a
goes
while.
in, out, straight out the other.
A lot of you
Okay.
guys were giving me the right answers that we were going through, so I think it actually does stay in for a lot of you, which is really good. So we kind of learned today that quadriceps are involved in knee straightening, glutes, hamstrings are involved in hip straightening. Okay, so we can kind of start to figure out a lot of these exercises that are involving those. What we're going to do probably in the next couple of weeks or so is go through a bunch of kind of videos, and we'll kind of run through how to figure exercises out and how to figure out you know, what muscles working during those exercises. Now we've had a bit of a deep dive into it, so that should hopefully kind of shed a little bit more kind of light on it. But hopefully that gives you a better idea of what's going on in terms of lower limb anatomy. All right, guys.
Great.
Cool.
Thank you.
Thank you.
Good stuff.
Thank
Cheers,
you.
guys. Have a
Great.
lovely rest
Thanks
of
a
your
lot.
Thursday evening, and I shall see you next week. All right.
Bless you.
Bye.
Thanks
Yeah,
a lot.
everyone.
Bye,
Bye-bye.
everyone. Bye.
Bye.